My name is Christina Thornton. I'm an assistant professor from the University of Calgary and a CF care provider, CF physician. And it's my pleasure to talk about today looking at human papillomavirus or HPV and cervical cancer in people with cystic fibrosis. And it's a great opportunity to get to talk about a very timely and important topic to the CF community. In terms of disclosures, I have no relationships related to my presentation. I do have research funding and investigator-initiated funding, which is listed, but not relevant for the purposes of this talk. So I wanted to start off with a case, and in fact, this research of ours that was done through the University of Calgary, done with my colleagues, Dr. Mike Parkins, Dr. Ranjani Somayaji, and Dr. Angel Chu, actually started when I was a resident, and followed me through the last couple of years. And this case actually really resonated with me as a trainee. So this was a person with CF, 39-year-old female. As noted, she had a history of CF. She had a lung transplant in 2009. She was a lifelong non-smoker, had no pregnancies or children. She had a previous pap smear in 2008 that was normal, and importantly, did not have previous HPV vaccination, nor was this discussed. In terms of her relevant medications, she was on fairly standard immunosuppression in the context of her lung transplant. So back in 2014, 2015 is when her story started. And she did go for a pap smear that unfortunately returned as abnormal twice. It came back as a high-grade squamous intraepithelial lesion, or HSIL, which we will go over, but this is quite abnormal. And she did require 2 cervical biopsies that did show features of human papillomavirus, or HPV, and a fairly high-grade lesion. So what do all of these abbreviations mean? So this is the terminology as it relates to cervical neoplasias. We won't go over all of this in great detail. This is when the doctor gets a pathology specimen and the pathologist looks under the microscope to determine how precancerous or not cancerous this could be. And our patients actually was on the higher side, which looked to be severe dysplasia. So what this means is that this is a high-grade lesion that has a higher potential to progress to be cancer, and unfortunately, a lower chance for it to regress. So as time went on, over the next 5 or so years, unfortunately, this patient had multiple abnormal pap smears, again, fairly high-grade dysplasia or abnormality with cervical biopsies. She had to undergo 5 LEAP procedures. So what this is a loop electrosurgical excision procedure, which is a common treatment that's using a heated wire loop to try and remove those abnormal or precancerous cells. This is designed to hopefully prevent cervical cancer. Unfortunately for her, this kept recurring despite these procedures, and it was recommended she actually pursue a hysterectomy or removal of the uterus, the cervix, and the female reproductive system. And indeed, her final procedure in April 2019 showed progression and an even higher precancerous lesion with P16 positivity. This is a serotype of HPV that is highly associated with cancer. So in 2020, she did indeed undergo a vaginal hysterectomy, removal of the fallopian tubes, and laser treatment to the vulva. And this was again done with curative intent, and associated with this, she underwent cycles of chemoradiation as well, given the high-grade malignancy. Unfortunately, despite all of that, she had recurrent squamous cell cancer of the cervix or cervical cancer despite therapy. And again, she had very invasive, very difficult treatments that were done to try and eradicate this. The story continues. In August 2020, as part of the routine screening, she was found to have a liver mass noted on imaging. A biopsy was done of that mass that unfortunately confirmed metastatic cervical cancer. She had a PET scan that looks for lesions across the body that did show hepatic disease with lesions everywhere. And unfortunately, in December of 2020, she passed away at home. And so this was a patient that really resonated with our clinic and our community. And her story was quite difficult, but it prompted a lot of research and hopefully some awareness that can be done from her story. So, just to talk a little bit about HPV and what this is, in all individuals, there is actually a high probability of acquiring HPV throughout one's lifetime. And in fact, studies have shown that in those that are sexually active, 80% have at least potentially one HPV infection by age 45. Many people associate HPV with cervical cancer, but there's a very wide range of symptoms and manifestations that could include cervical cancer, but they could include other types of cancers, warts, lesions in the head and neck as well. And importantly, while we often associate this as a cancer of females, it is important to note that many men can be affected as well from a biological sex perspective. Currently, cervical cancer is the fourth leading cause of female cancer deaths worldwide. And importantly, 90% of deaths are attributed to HPV infection. This will become very important as we talk about preventative strategies, including vaccination to prevent this. And so, what do we know about HPV and CF? Some of the earlier studies that were done in 2018 by this group out of France looked at their transplant center of sexually active CF women and looked to evaluate those that attended to see rates of complications. What they found is they had a cohort of 32 non-transplanted and 15 transplanted females with CF and found about 43%, nearly half had an abnormality. Higher in those transplanted with an abnormal pap smear in about a third. And just about a fifth of individuals had HPV-related disease, so either cervical or vulvovaginal, which is pretty high and suggests that there may be an association there. And so when we looked at this, we were interested based on that early work as well as the patient who I presented earlier. We were interested to look in our clinic. And so we sought to formally audit our population and determine prevalence of HPV-related disease as it pertains to the transplanted population. So this study that we looked at in Calgary was published in 2022 in Thorax with my colleagues that I acknowledged earlier. And so what we found is we looked at our cohort. We found 34 transplanted females that were identified. We looked at multiple different clinical factors, such as the type of CF they have by genotype, any comorbidities, age that they were transplanted, if they have diabetes, factors related to the transplant itself, what kind of medications they were on, and we could not find any difference in those that had or did not have HPV complications. So as a group, they were fairly similar. What we did find, however, is that 12 patients, or about 35%, had at least one abnormal pap smear. The vast majority following lung transplant, because these patients and these individuals are very immune suppressed. And among those with abnormal PAPs, they were fairly young. So the median age was just under 27 years old. 75% had cervical dysplasia, and 25% actually had anogenital warts, which is not something we often talk about, but more and more this does come up in the literature. We also found that looking across the study timeframe, which was over 13 years, as noted, about 35% had abnormal PAPs. But importantly, a quarter had cervical dysplasia. So again, this is sort of that leading to potential precancerous. And just under 12% had fulminant cervical cancer, with the median time about 6 years from lung transplant to first abnormal PAP. Our numbers were very small in this study, so it's difficult to make grand conclusions just given our single center study. But we did find there was a trend towards greater odds of cervical dysplasia in those that had CF and transplant compared to those that did not. And then looking at the cases we had, two females actually required surgical vulvectomy after failing fairly aggressive salvage therapy. And in total, 4 individuals developed cervical cancer, with 2 passing away from the disease, including the one I mentioned earlier, which is really, really very tragic. And I think what this study highlighted to us and resonated with some of the community is for an individual CF to go through the difficult and very prolonged process to get a lung transplant, and then to many of them develop complications and actually have a group that passed away from cervical cancer, which is, for all intents and purposes, a preventable disease, is something that really raised awareness in our clinic, for which we've actually very aggressively looked to vaccinate our cohort and hopefully raise some awareness. So just to take a step back, what are some HPV risk factors in CF? We know that those that are at highest risk are individuals with profound immune suppression. And we know that lung transplantation is arguably one of, if not the highest organ in terms of immune suppression. Other studies have been done outside of lung, but including lung, looking at solid organ transplants and found in those compared to that don't have a solid organ transplant, we see 2 to 6-fold higher rates of cervical neoplasias, 3-fold higher rates of cervical cancer, and up to 50-fold higher rates of vulvar cancer. So it is quite important. And while many individuals think of cervical cancer and HPV together, as we alluded to earlier, there are many other complications and HPV-related malignancies for which there is no other routine screening program. So it's really important as a community, either individuals living with CF or CF care providers, to be thinking of this when evaluating people that come to clinic. Um, I sort of alluded to this earlier, but what about vaccinations and preventable disease? So there, HPV has many genotypes or types, but there are several that are the vast majority of cervical cancers, which are indeed covered by the vaccinations that are currently available. And as things develop, more and more serotypes or types are added to help increase coverage. And we have the good fortune now of having lots of really robust data, large studies that have looked at randomized controlled trials that have shown vaccinations are safe and effective. So I have several listed there as references, but we find that there's an 86% decrease in HPV infections, 40% decrease in anogenital warts, and 80% decrease in some of the higher grade cervical dysplasias. We also know that the greatest impact is adolescents prior to sexual debut, and this follows contemporary guidelines and recommendations. And in fact, just hot off the press, just a few weeks ago, there were 2 Cochrane systematic reviews that were just published, very large studies that showed a total of 285 studies. These 2 systematic reviews looked at randomized controlled trial as well as real-world observational data, but in total they found 132 million people in real-world data, over 150,000 in randomized trials, and taken together, there was an 80% reduction in cervical cancer when given before age 16. So this is probably arguably one of the most robust data sets we have of any intervention, but very topical as it pertains to HPV and cervical cancer. And importantly, across this very, very large, both observational and high-grade randomized control data, there was no increase in serious adverse events. And so when we take a step back and look at our cohort and CF and HPV vaccinations, when we looked at our transplant study, indeed, none of the patients in our study were vaccinated against HPV, either prior or following transplantation. There are probably several factors for this, and I think as the CF community is growing older with the advent of amazing therapeutics, this is an area that we really need to target and follow with regards to guidelines. And in fact, while there are no clear specific guidelines for HPV vaccinations following transplantation, if we extrapolate from the general population in Canada and in the US, where these guidelines are fairly similar, both the National Advisory Committee on Immunization, which is kind of the governing body in Canada, as well as the CDC in the US, recommend HPV vaccination for all individuals, both male and female, typically given age 11 to 12, but recommendations of age 9, as early as age 9, again, highlighting that the best efficacy is in adolescence before sexual debut, but there is catch-up recommended up to age 26. Thereafter age 26, it's on a case-by-case basis, but this is general public guidelines and recommendations. And so one of the questions that comes up or came up with our initial study is, are we actually as CF care providers aware of our individuals' HPV vaccination status? And in fact, again, that same group out of France looked at this in an adolescent and their caregiver cohort. and found that the majority of barriers or concerns had to do with healthcare providers. And indeed, when individuals of CF were asked what is a factor related to potentially getting vaccine, they talked about healthcare provider positive advice as a strong proponent to go for the vaccine, fear of HPV related disease as well. And when discussing around barriers, insufficient knowledge was identified as the number one target. And so this really highlights that unique relationship between individuals of CF as well as their care providers in clinic, and an area historically we probably have not talked about very much in our clinic visits. And so we were really interested to explore this a little bit further, and wanted to expand our findings across Canada to look at prevalence and impact in individuals with CF outside of the transplant population. So this was a study we completed as well in 2024. This was a cross-sectional national online survey of individuals with CF. We invited all provinces across Canada, and we looked at multiple factors, including self-reported HPV infection, disease complications, quality of life, vaccination status, and barriers identified. And so when we looked at this study, as mentioned, we had 235 individuals respond. The vast majority were from urban areas. We had good representation across the country and all provinces. This cohort was younger, at a median age of 34. Majority were female sex and identified as women in terms of gender. 13% had a prior lung transplant, and about 3/4 had an educational level above high school completion. So fairly represented cohort of what one would expect to see in an adult CF clinic. When we asked the question, so we were interested to identify self-reported knowledge from these individuals. And not surprisingly, 95% had heard of HPV, so people are familiar with this. What was surprising, however, is about half of females with prior PAP testing had self-reported an abnormal result, which is a lot. Indeed, about a fifth of individuals had a history of HPV-related exam to evaluate for complications. So those are those complications that can range from dysplasia, warts, etc., as we noted earlier. 12% had fulminant HPV complications, as you can see there. And almost 70% had an abnormality which required colposcopy, which is a fairly invasive procedure. So we were quite humbled by these results, and it just goes to show this is not a rare finding. This is a common finding in CF. And again, probably an area we haven't explored historically, but more and more as holistic care providers will need to look into. And I think the most striking thing we found from this survey is when asked the question, how many have actually discussed HPV and HPV complications with their CF care team, just 19% had reported they had. And so while the model is changing, currently the majority of individuals' primary care is the CF care team and the CF provider. This is an area that we can really intervene on to improve quality interventions. When asked about vaccinations, we found 62% were unvaccinated for HPV. Again, if we think back to what the guidelines or recommendations are for the general public, this is quite below what would be expected. Amongst those that were vaccinated, only 41% had completed all 3 doses of the schedule, meaning the majority had not completed the full schedule. Notably, 80% had reported never talking about the vaccination with their care provider. So in clinic, I think particular CF care providers, we often will talk about other vaccines as it pertains to their lungs, but vast majority we have not. Amongst those of lung transplant, however, the majority had discussed this with their CF care team, so suggesting that group may be a higher risk, so people are discussing it, but I think there's a lot we can intervene on. And I thought this was really telling. When asked amongst those that were not vaccinated, what was the reason you were not vaccinated? Number one reason, similar to what we saw in that French adolescent study, was lack of discussion with their CF care provider. So it really suggests this is an area that we can intervene on. Lastly, with this study, we were curious and interested to look at sort of quality of life measures and burden that individuals may have. And so we found that amongst those with self-reported complications, there was a high psychosocial burden, as noted with this HPV impact score. So this is a fairly high score, suggesting individuals, it is affecting their day-to-day life having this disease, with the highest burden, not surprisingly, but unfortunately around self-image, sexual impact, and worries and concerns. So what this study taught us or showed us was this is not a rare finding. HPV is prevalent amongst individuals with CF, both in terms of complications physically, but as well as mentally in terms of quality of life. And so I can say anecdotally, what we've done at our center is now we make it a point to really intervene when individuals come to our clinic, ask about HPV vaccination, offer it, especially for those as a catch-up series. And I think we've done a pretty good job at our clinic trying to get our rates up and having these frank discussions. Anecdotally, I will say individuals, when asked, they do want to talk about this. It is an important area of health, but historically, we probably haven't gone into that level of detail. So hopefully that will change as we learn more and more. Lastly, or last couple things I wanted to chat about, a lot of this study was done pre-modulator era or pre-ETI. So what do we know going forward? Is this even a problem in CF anymore? This is a very recent study that was done using the Canadian CF registry, just came out published. And it looked to compare CF non-pulmonary comorbidities as compared to the general public using an Ontario administrative data set. And what this found, looking at rates of complications per 1,000 person years, there were four factors that were associated, but I want to direct your attention to cancer. And not surprisingly, of course, in a transplanted cohort, the rates of cancer are much, much higher. But when we look at CF in of itself, without any sort of transplant, we see that the risk is higher compared to the non-CF group. And importantly, complications were developing as early as 20 years earlier than the non-CF group. So this suggests that, of course, while transplant is a very high risk with its immune suppression, there may be factors as it relates to CF itself that can predispose. So I think more and more intervening on earlier and sooner will become a mainstay as we go forward in this new era with modulators. So just to summarize a few take-home points, we feel strongly from our studies that it's important to vaccinate all individuals with CF before sexual debut, particularly as it parallels the recommendations for the general public. We know that there is a greater risk potentially as potential transplant recipients with best efficacy at primary prevention. We know that vaccinating adults after that age 26 is on a case-by-case basis, but there is some data that suggests it can reduce risk. So for individuals with CF potentially listening to this, I would really encourage open dialogue with your CF care team and providers to see what options may be available to make a mutually informed decision together. Specifically for transplant populations, it's incredibly important to screen not just for cervical cancer, but for all HPV complications. And while the main point of contact is still our CF clinics, this is something that is a CF problem and does require attention by CF care providers. And lastly, what I just wanted to touch on is globally, for the first time ever, the World Health Organization actually deemed November 17th to be World Cervical Cancer Elimination Day. Many countries, actually just over 190 countries, have signed on as a global strategy to try and accelerate elimination of cervical cancer. There have been thoughts and lots of opinions around trying to eliminate this by 2050. So because we know that the association of HPV is so high and we have such good therapies in terms of vaccinations to limit this risk. And in fact, just last week, there was an article out of Australia where HPV vaccination marks a milestone in that Australia, for the first time, had no new cases in people under age 25, almost certainly due to a very strong national HPV vaccination program. So all this to say, there's a lot that can be done, and it's just about raising awareness and having open dialogue with your care team.